available to those struggling with mental health. Good morning. I'm Haley Hernandez. Jarrell Johnson is charged with the murder of his 69-year-old mother, Eva Peavy. Deputies found her body inside the garage of her East Harris County home yesterday. They say Johnson was found nearby with a hammer. Johnson's stepdad says that Jarrell battled with schizophrenia and bipolar disorder for a long time. Court records show Johnson had previously been arrested for trying to choke his mother, a case that was later disposed. Despite it all, Johnson's mother never gave up on him. While law enforcement continues to investigate the crime, I'm joined by Dr. Megan Houston, a licensed psychologist and owner of Houston Behavioral Health. She's here to talk to us about mental health and how it plays a role in all of this. Good morning. Thank you for joining me.
Good morning. Thank you so much for having me this morning.
So the stepdad tells us that this suspect had schizophrenia. Talk to us about schizophrenia. What would the signs and symptoms of that illness be?
Okay. Well, thank you so much again for bringing attention to this important topic. And while I am unable to comment on the specific details of the recent tragic case, I am definitely able to talk to you about schizophrenia and help the community better understand what happens when somebody has schizophrenia. Schizophrenia typically shows up during what we call young adulthood, which is typically between the ages of 18 and 25, though it can happen at different ages. And this time is particularly challenging in somebody's life because it's right when young people are starting college or beginning careers or making other major life transitions. And what's really interesting about schizophrenia is that it develops from a mix of factors. So sometimes it runs in families, there's often a genetic piece to the puzzle, but environmental stressors and brain chemistry also play really important roles in the development of schizophrenia. When I try to explain this condition to families, I often like to use this analogy. Imagine your mind is like a radio picking up multiple stations at once. And for someone who has schizophrenia, it becomes really difficult to focus on what's real and what isn't real. And so what's important for families to watch out for are changes in behavior. So if someone starts hearing voices or seeing things that might not be there, they might develop unusual beliefs that don't really match reality or show drastic changes in their personality. Sometimes there's early signs. They're more subtle. So such as withdrawing from friends or family, maybe showing less emotion than usual, or having trouble with daily tasks. Changes in sleep patterns, dropping out of activities they used to enjoy, or having some struggles at work and school are also early warning signs.
I want to jump in here now because not everybody who has that is going to go commit a crime. So when do we recognize when this is dangerous to people around them?
Well, it just depends on what's happening. So for instance, this person was reported to be using synthetic marijuana. And first, let's be clear that everybody with schizophrenia, they're not inherently violent. However, it's crucial to understand that if we're using illicit substances, which sometimes happens when someone isn't being treated for schizophrenia because they're trying to alleviate what they are experiencing. And so they will turn to illicit substances. And this can lead to a perfect storm of problems. And so it can trigger psychotic episodes or interfere with their medication. It can lead to unpredictable behavior. So it's like throwing gasoline on a fire. So it makes the symptoms of schizophrenia a lot harder to control despite, treatment.
Yeah. Well, we're going to run out of time. So we need to talk to people about the resources and specifically address what happens if you cannot afford to see a mental health therapist. Lots of mental health experts, they won't take insurance. They're charging $100 to $200 a session. So how do we get help for a loved one?
Absolutely. I'm glad you asked this because there is help here in Houston. So if someone is in immediate need, the Harris Center Crisis Line is available 24/7, and you can reach them at 713-970-7000. You also have excellent emergency psychiatric services at Ben Taub Hospital that does take care of people who are indigent and they don't have insurance. And NAMI Greater Houston offers wonderful support for families. They offer support groups and education. So what I will say is this, there are resources out here. You just have to understand where they are and who you can go to. Again, Harris County and Ben Taub Hospital are great resources. The one thing I do want to say is this and leave you with this. Please don't wait until there is a crisis when you're dealing with somebody that has a psychotic disorder or schizophrenia. The symptoms of schizophrenia can be terrifying for families and the person experiencing schizophrenia. And because of this, we may mitigate what's happening, or we're in denial about how serious it can be. Please don't do this.
Well,
if you notice concerning changes in your loved one, say something about it early, because early intervention leads to better outcomes. When we allow it to continue to go, it really complicates the condition. And
I think a lot of people understand that. A lot of people don't want it to get to the point of crisis. But when you say that the resources are at places like Ben Taub, a hospital, that's when you've gotten to the point of crisis. So would it be NAMI and the Harris Center who could offer more regular therapy?
Yes, absolutely.
Okay. So those are the resources that people need to know to maintain their mental health before it ever gets to the crisis point.
Yes, absolutely. And again, and if we're dealing with schizophrenia or psychosis, the way we manage that is with, medication and consistent treatment. And oftentimes compliance is an issue. So it really does take a village. It's the family, it's the clients that we like to work with, because the treatment is going to be a little bit more complex because of the complexity of the disorder.
Yeah, this is so great to shed light on this. Dr. Megan Houston, thank you so much. We appreciate your time this morning. That was very helpful.
You're welcome. Thank you.